Transepithelial corneal cross-linking. Transepithelial corneal cross-linking is an innovative technique for the treatment of keratoconus and corneal ectasia. Procedure and mechanism of action. The transepithelial cross-linking treatment uses a harmless substance, the riboflavin contained in rycrolin TE, to create a chemical reaction within the stroma. The chemical reaction, triggered by low-intensity UVA irradiation, results in the diffusion of the bonds between the collagen fibers, which are decreased in patients with keratoconus. This enhances the mechanical strength of the cornea itself, thus reducing corneal bulging. The UVA irradiation, in combination with rycrolin TE, triggers the release of reactive oxygen species that react with certain amino acids contained within the collagen fibers, thus inducing the formation of new high-strength cross-covalent bonds. As a consequence, the collagen in the corneal stroma is reorganized in a more compacted way. No post-treatment pain. No complications due to de-epithelialization. No deterioration of visual acuity following the intervention. No need for an operating room. Simplified intervention. Instill 1 drop of pilocarpine, 2%, to induce a tight meiosis. The patient has to be put in a recumbent position. The periocular region has to be cleaned with an adequate antiseptic solution. Instill 1 drop of rycrolin TE every 2 minutes, 30 minutes before treatment. Instill topical anesthetic eye drops, single dose, 1 drop every 4 minutes, repeated 4 times, beginning after the first drop of rycrolin TE. Instill the topical anesthetic eye drops again, single dose, before starting the UV treatment. Proceed with irradiation for a total of 30 minutes. 6 phases, 5 minutes each. Instill 1 drop of rycrolin TE at the beginning of each phase. At the end of the 30 minutes of irradiation, wash the cornea thoroughly with a balanced salt solution or an ophthalmic saline solution. Best corrected visual acuity improves immediately for patients treated with transepithelial cross-linking, while it continues to worsen for untreated patients. Uncorrected visual acuity improves immediately and remains stable over time for patients treated with transepithelial cross-linking, while it continues to worsen for untreated patients. The curvature at the cone's apex is reduced in eyes treated with transepithelial cross-linking, while it tends to increase over time in untreated eyes. Over time, a significant difference can be seen between the coma of eyes treated with transepithelial cross-linking and that of eyes which have not been treated. A shorter permeation phase can be obtained thanks to iontophoresis. This technique consists in the application of small electrodes, which allow for the rapid passage of the riboflavin into the eye. The goal is to reduce the absorption phase from the current 30 minutes to just 3 to 5 minutes, thus considerably increasing the compliance of the patient. A shorter irradiation phase thanks to the use of higher power irradiation sources with respect to those which are currently employed. The prospect is to achieve a total treatment time shorter than 15 minutes. Refractive transepithelial corneal cross-linking. The technique will be increasingly oriented towards the refractive aspects of the diseases being treated. Integrated technique. The combination of transepithelial cross-linking with intracorneal rings. The initial results presented in the literature have shown that the combination of these two techniques seems to promise major improvements for both uncorrected visual acuity and best-corrected visual acuity. Combined use of keratoplasty to reduce post-treatment astigmatism. Broader field of application of transepithelial cross-linking with respect to the treatment of keratoconus and corneal ectasia.